I can tell you that I was fairly ignorant about sexual health when I was a young person. I think it would be true to say I had quite a protected childhood. I went to mostly girls' schools, and I changed schools a bit because my father was transferred from state to state, and I went to boarding school as well. I was a pretty good school student, but when I went to uni, I became a pretty terrible uni student. And I remember when I got to university, I'd never actually heard of sexually transmissible infections. And of course, in those days, they were actually called venereal diseases. And I always remember, I can actually remember where I was standing at university when somebody talked about venereal diseases. There was another student, and I said, "What on earth are they?" And she said, "Just go and look it up in the library." And I did. And that was the first time I'd ever really understood anything at all about venereal disease. So when I was at uni, I was doing a science degree. I majored in physiology and psychology. And so effectively, I was kind of looking at the science of the body, but also the science of behaviour, people's behaviour. And when I finished uni, I ended up working on a study around palliative care as a research assistant. And then, as often happens in academic departments, if you're quite good at research, you're a good research assistant, you get swapped, transferred from one academic to another. And I ended up doing a few jobs in research in a department of community medicine. And then the boss said to me, "Look, I think you really need to do a Master of Public Health degree." Now, for those of you who don't know, a Master of Public Health degree is largely a coursework degree, which teaches you a whole lot about different kinds of techniques. It teaches you about public health, teaches you about evaluation of health programs. And I found that all extremely interesting. But I did decide as one of my units to look at infectious disease. And the infectious disease unit that was on offer at that time was something to do with sexually transmissible infections. And we were invited to go to Melbourne Sexual Health Centre, which is a specialist clinic for sexual health. And we had lectures in the room of the medical director there. And he had worked many years ago in New Guinea at a time before really antibiotics were freely available. And so, and of course, this was pre-computer times too. So he showed us images of these different diseases projected onto the wall in his office. And he stood next to the wall and he explained each different case. They were often really gruesome pictures, frankly. But when he talked about each case, he spoke so tenderly and so compassionately about each of these patients that I could see how their particular STIs, sexually transmissible infections, were really a big disability, and I could imagine their shame and their pain. So this was all happening for me at the same time here in Australia as the first AIDS cases were being diagnosed. And at that stage, when AIDS was first diagnosed, people understood that it was largely being transmitted within the community of men who have sex with men, but nobody really knew how that was happening. So I think for me, those two events made me realise that, I was very interested in physiology, but it was the first time I ever imagined that that there was a relevance in psychology, a relevance of psychology to the way in which diseases were transmitted. And so I think, I am interested in sexual health for a whole range of other reasons as well, but I think it was those kinds of moments that allowed me to see that if I had a psychology background, I could bring something powerful to my physiology background that might actually help in managing the transmission of STIs. Okay, well, look, sexual education for adolescents is absolutely critical, and there's a lot of reasons why we need to focus on this. And really, the job of an adolescent, when you think about it, is to test adult behaviours, because they're learning about what kind of adult they want to become. And so a lot of these adult behaviours may be risky. There are things like, alcohol, dangerous driving, unsafe use of drugs, unsafe sex. It's really important to understand the risks attached to these and how they might interact and how to manage them. So yes, it's absolutely essential that sex ed is for adolescents, at some point in their life, in their early adolescence. But sexual health is actually important for everybody across the lifespan. Now, The World Health Organization about 20 years ago defined sexual health, and I'm actually going to read this out because I think it's, I'm never going to be able to remember it otherwise. Sexual health is a state of physical, emotional, mental and social well-being related to sexuality. It's not merely an absence of diseases, dysfunction or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination and violence. And for sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected and fulfilled. So when you hear a definition like that, it makes you realise that sexual health covers an enormous variety of issues. So it's not only just disease and dysfunction, it's about, those are the negatives, but it's also about well-being. And everyone has a right to respectful and safe and pleasurable sexual experiences. And when you think about this, it's easy to see how it's something that we really need to consider across the whole lifespan, not just during adolescence or young adulthood. So while sex ed is obviously important for young people to give basic information, it's not enough to just have it at that one time, you know, in your life. And we also know that many young people are dissatisfied with their sexual education. While they may remember some aspects of biology they were taught, our research shows that many young people, when they grow up, even by the time they get to university, they don't remember the sex ed they had at school, or they say it was uncool to be interested when they're at school, so they ignored it. And so even young people who've had excellent sex ed often need a refresher course because different things may interest them as they get older, and they need different kinds of information for different stages of their life. And one of the key things that's not really covered very well in sex ed is around negotiating relationships. And we also know that sex ed is usually much more focused on heterosexual relationships, and there's not much time spent on gender diverse or same-sex relationships. But I mean, questions like, you know, how do you bring up a discussion about safe sex when you're having a one-night stand? Or how do you tell a partner the things that you sexually like or the things that you don't like without hurting their feelings? These things are often not really covered very well in sex ed, if at all. And those questions actually around negotiating relationships, they're relevant to people having sex no matter what their age is. You know, there are some aspects of sexual health which apply to all age groups, like how to practice safe sex. But there are aspects which might become important at particular times in our lives, such as when we have an STI or during pregnancy, or if you've developed some dysfunction. So, you know, you really need to sort of think about how the fact is that people want to have an active sexual life, you know, usually across their whole lifespan. And intimacy is a really important part of overall well-being, but people have different lifestyles. And so, you know, you need to think about how the sex ed will fit into those lifestyles. So, you know, you might have one person who might choose to remain single for their whole lives. They might just have a variety of partners, and they need to learn to negotiate safe sex across that whole lifespan. Then there are other people who'll choose to settle down with a partner. They might have a family and a monogamous relationship, and they'll probably have different sexual health needs. If one partner becomes sick or incapacitated, those sexual health needs might change. And then there'll be others who prefer not to have a sexual partner for the whole of their lives, you know. So there are lots of different kinds of lifestyles, and to manage each of these lifestyles, people are going to need sexual health information delivered in different ways at different times. So the other thing we've got to bear in mind when we're thinking about, you know, this whole area of sex education and who it fits for, is that society changes over time. So when I was a girl, we had no computers and we had no mobile phones. So, for example, pornography was only available in magazines, and you could only buy them over 21, you know, and you had to prove that you're an adult. And of course, sexting hadn't even been invented because nobody had mobile phones. So for my generation also, sex ed was pretty much, you know, non-existent. And many older people who are now seeking a new relationship also grew up in a time when sex ed was not you know, just wasn't a thing at all. So, and the other thing we've also got to think about is that, you know, Australia, we're very lucky here because we have people who come to make their home here from many different countries. And many of them have had very different past sexual experiences to those who are already here. Now, some of those people, unfortunately, have come from war zones. They may have experienced sexual violence or torture. Others may have just come from countries with very different customs, and they may find when they arrive here that very different social rules apply. So they need to learn sexual health within the Australian culture, even if they choose to keep their traditional values. So in my view, sexual health is important for everyone, and everyone needs sexual education, no matter what their age is. Okay, so well, we know that sexual activity actually enhances mental and physical health during aging. We know that as people age, they do develop more chronic health conditions. And when I talk about chronic health conditions, I mean things like arthritis, diabetes, cardiac disease, asthma. Those chronic conditions increase with age. So maintaining sexual health might be important for helping people to manage the effects of these chronic conditions, because intimacy and sharing and partnership are all things that help keep us well. They give us a feeling of well-being. So while we know that sexual health is really important to older adults, there's actually not a whole lot of research that has explored the sexual behaviour and the sexual health needs of older adults. So quite a bit of our information on sexual relationships in Australia comes from an enormous study called the Australian Study of Sexual Health and Relationships. I think I've got that right. So it was first done in 2003. And when it did that, it looked at behaviours of adults, but it only looked at the behaviours of adults between 18 and 59. So it didn't go very high. When it was repeated in 2011, it stopped at 69 years. So, you know, there was very little information about the sexual behaviour of older people included in that study. And that study had over 20,000 people in it. So it was a really good, strong population-based study. So there's only one kind of major study that I'm aware of since then in 2015 called Sex, Age and Me. And that was specifically done of people over the age of 60, but it still only included, I think, around 2,000. So, you know, given the proportion of people we have in the population, this is not very many. And effectively, because there's not much known about the sexual behaviours of older people, they're very rarely mentioned in policy documents. So Australia has a fourth national strategy on STIs, and it has 6 different priority populations that are mentioned specifically in that. And young people is one group, but older people don't make it into that at all. Now, the other thing that we do need to think about here is that the world has an ageing population. So globally, by 2050, the number of people in the world is expected to double, and who are over 60. And this means that all major areas of the world, I think except Africa, will have nearly 25% of their populations aged 60 or over. That's quite a large proportion of the population. And if you're not looking after their sexual health and communicating with them about this, that's quite a large proportion of the population who are being left out. So we do need older people to be sexually healthy. And I don't really think the problem is that older people don't want to discuss sexual health. I think what happens is that the older people get, the more invisible they become in our society, and they get fewer opportunities to make their voices heard in general. And you think about this, there are very many negative stereotypes about older people. I mean, most older people, including me, well, actually, most older people, you know, they're portrayed negatively, you know, really in movies and in books and so forth. And most people don't think that their parents or grandparents would ever have sex. And I remember when I was young, I couldn't even imagine my parents having sex. It just seemed like too creepy. But, you know, the whole problem is that the way in which older people are portrayed in films and TV and so forth, they're not portrayed in a way that suggests that they could be sexually active. Often they're seen as frail or dependent or unattractive, and sometimes they're even seen as a source of mockery. So this kind of perpetrates these myths that older people are not sexual beings. But we do know from the limited research that has been done, including research that we've done, that sexuality is important to older people, and they do want to go on having intimacy in their lives. And in fact, they often do have intimacy in their lives. But it's also true that they're nervous about asking sexual health questions because they feel embarrassed and they don't always know what to ask. And they also do fear being judged. But curiously, from my research on young people, those are pretty much the same things and the same concerns that younger people have too. So, everyone's the same in that way. So we've done some work with older people, and we've asked them about who they would speak to if they have questions about sexual health. Now, some have sought information on the internet and really struggled to find things that were relevant to them. But most would say that they would seek advice from their GP. And some say, just like young people do, that they would prefer to speak to a GP of the same gender as them and who is closer in age to them. That's very common. It doesn't matter what age you are. People, if they're wanting to talk about sensitive stuff, they often want someone who they see as being a bit similar to themselves. But we also know from our research with GPs, and we've done quite a bit of that, that GPs often assume that older people have little interest in sex and that managing their other health needs is more important than managing sexual health needs. So if somebody's got chronic diabetes, the GP will prioritise that and won't even think to ask the person about their sexual health. And we also know that GPs have little knowledge of the sexual health needs of the older population. And we also know that GPs themselves are sometimes embarrassed to bring up sexual health with older people, particularly if they haven't had training around that. So I genuinely don't think it's older age that makes it hard for some people to talk about sexual health. I think it's much more about the way in which we set up the situation for people to have these sensitive discussions. I mean, some people don't want to discuss anything at any age. They prefer privacy. But for people generally to talk about sensitive issues, regardless of their age, they want to feel respected and to know that others are not going to judge them. And as I said, I think that that's just the same for everybody, regardless of age. So the way that I can see that we could potentially get around this is that GPs and older people both need to let each other know that they're open to discussing sexual health. So with GPs, I think it's the way they set it up. They can say to a patient, look, I consider sexual health to be just as important as other aspects of your life and your health. I'm very willing to discuss this with you, so let me know if you've got any questions around that. And that is opening the door, And similarly, older people, if they haven't ever brought this up with their GPs, there's no reason why they can't say, look, I want to make sure that I'm sexually healthy as possible. So if there's any particular things you think I should be doing, please let me know. I'm very happy for you to talk about this with me. And if you don't want to talk about this with me, can you refer me to somebody who might be happy to talk to me about this? So I think that's a way to get around that aspect of it. But I also think it's critical to include older people in sex ed campaigns. And the sex ed campaigns need to have good content that is relevant. It needs to be delivered in a way that is helpful and is accessible by each of the target audiences, and people on the receiving end need to hear it. So it needs to be all set up so that it's for them. So I think this is an incredibly important thing to remember when you're designing these kinds of programs. You have to have the consumer involved, and this is regardless of whatever age group you're designing sex ed programs for. You need to have the consumers. You need to ask them what's going to work for them. You need to test it on them, and that is really the only way you're going to find out whether that's going to work for them. So I think some of these steps would really help older people talk about sex. In fact, I think they probably help all people talk about sex, but it is critical to have consumers involved in research. Well, from my perspective, it doesn't really matter what age you are. It's your behaviour which is likely to cause disease transmission. It is true that the rates of some STIs have been rising in older age groups, And there's probably a range of reasons for this. You know, we have had shifting values in society. I think over the last, 2 or 3 generations, divorce is quite easy to get. It's more socially acceptable than it was 50 years ago. But also people are living longer. They're in much better health than they used to be. And so after the divorce or death of a partner, they may want to re-partner. And we do see increasing numbers of older people using the internet to date, to meet new partners. But the health risks of dating is not being offered anywhere which is easily acceptable to older Australians. And this is something critical for them to learn. Now, we do know from some research that's been done in the last decade that many over 60s have sex on the first date, and most initiate sex within 4 weeks of meeting someone over the internet. And we also know from research that women over 40 who are using internet dating are less likely to insist on condoms with their partners, even if they do bring up the issue of safe sex. So we know that this behaviour can be improved, really, to make it safer. But everyone who's dating needs the same advice. And that is education about the right risks of STIs and how to prevent them, and how to negotiate the use of condoms for protection against STIs. So if we're going to try to improve this with older people, we need to get this information out to older people in an appropriate way. So as I mentioned earlier, I think we need to change the advertising and the narrative around how older people are seen in our society. As if we only portray older people all the time in ads and so forth as being grandparents or as being frail or dependent, then people begin to see that as the way older people do and should behave. And the fact that many diseases show no symptoms also makes it difficult for people to recognise or consider that they might have an STI. So a lot of older people who know nothing about STIs don't even know that. So we need to get that information out to them. And of course, as it is for every single person who's sexually active, having an STI checkup before starting a new relationship or before having sex with a new person is absolutely critical. So I guess, we could try and think about, well, how can we encourage older people to have an STI checkup? What's going to make it possible for them to feel comfortable about doing that? And I think that we do need to think about changing services slightly to make them more welcoming for older people around that whole thing about STIs. So we know from our research that, as I said before, some older people might feel embarrassed about asking for an STI checkup with the GP because they don't want the GP to think that they are behaving in an inappropriate way for an older person. So we need to kind of think about, well, what's an easy way to get a checkup? So one of the things that we have started to explore in our research is there any way of alerting the GP prior to a patient entering a room about the fact that this next patient wants to discuss various elements of sexual health? So we are planning in some future research to use a kind of like a checklist that the person fills out either before in the waiting room, or if it's online, that they can email to the doctor, so that when that consultation starts, the ice has already been broken. Both parties know why they're there, and in that way they don't have to go through any embarrassment. So that's one thing that we're going to be checking. So and this importance of a sexual health check really can't be overestimated, but there are other ways, if people don't want to kind of go straight to the GP, there are other ways that testing can be made easier, not only just for this group, but actually for any group. So we know, for example, that it's possible now to do online telehealth consultations where you can actually get a pathology slip for an STI test and then go straight to the pathology provider without actually having been in the same room with the doctor, and get blood taken, or you can do a urine test at home and either mail it or drop it into a pathology testing service. And when those results come in, if there is something abnormal, at that point you need to actually see a doctor face to face. But at that stage, you're actually armed with the information you need. You either know that you've had some abnormal test results, or you know that there is something you need to discuss. So it kind of also breaks down the ice. So that's another possible way that we could, I think, we could help older people. But we also, you know, as I've been harping on a bit about, we need to think of ways of delivering tailored messages to older people. So we need to make sure that we use older people in the design of any information that we want to put out there, and to make sure that it's going to be accessible to them in a format that they would normally like to read about or hear about. And, you know, we haven't really ever spent any time trying to work out how to tailor those messages. One of the things that I've been thinking about, we need sort of some novel ways of doing things. We know, for example, that vaginal dryness is a common problem for postmenopausal women. So I've been thinking that maybe we need a range of condoms that are especially packaged for older couples, which has pictures of, you know, older couples on the outside, making it clear that it's for them, and maybe they come with a larger volume of lubricant, you know, in the pack, something like that. So, you know, there's ways that we can think about doing these sort of things, but we also need to involve, as I keep saying, the consumer in designing these. And I think that's really important. But I guess the other thing that we need to also think about is policy. So, you know, when I was young, I didn't really understand that strong role of policy in managing the way in which health is delivered across, you know, Australia. You know, we need to change policy to include older Australians, which, you know, to highlight that they also have rights to sexual health. And I mean, I'm just even thinking about one thing, you know, nursing homes, for example, very few have double beds. If someone wanted to carry on a relationship with their partner or start a new relationship while they're in a nursing home, there's no privacy. You know, those doors don't, you know, lock very well. I mean, you know, there are some places that are making headway with this, but this is not standard practice. So there's very little independence for older people wanting to start a relationship in a nursing home situation, for example. And I think it's always worthwhile thinking about the fact that, you know, many young people, if they were caught having sex by their parents, they would feel probably really embarrassed about that. Truthfully, many older people, if they were caught by their kids having sex, particularly with it in a new relationship, they would feel very embarrassed by that. So the funny thing is that until we really all respect that we have equal rights to safe and pleasurable sex, it's going to be hard to get changes in the systems that support sexual health. And also will be hard to get changes in attitudes. Okay, well, look, the last few decades have seen some big changes in life. And I think from a sexual health perspective, it's interesting to think that most STIs, sexually transmissible infections, are now treatable if they're not curable. And when I say that, there are very many, of course, that are cured by antibiotics, but there are some that are viral, which are not curable, but antivirals are available to keep them, you know, suppressed, very well suppressed. If you think about things like pregnancy can be prevented very well. We've got so many contraceptive choices that we didn't have, you know, 50 years ago. And in the case of unprotected sex, you know, there's the availability of the morning after pill, you know, if you have an accident and you had unprotected sex one night. So, you know, from a sexual health perspective, I mean, that's amazing to think that we have moved on so much in the last 50 years. But we've also got a kind of a very new environment. You know, computers and phones offer a huge amount of freedom to hook up with people, and they can also be used to find out information privately. And I think in some ways the computers and phone also kind of contribute to what I see as the mismatch between the public face of sexual health and the private face of sexual health. So if you think about what you see every day around you, we're surrounded by public images and subliminal messages that you must look a certain way to be attractive, that attractive people are the ones who have the most sexual partners, that attractive people are great lovers, that every time attractive people have sex together, they both have an orgasm at the same time. You know, people lock eyes across a crowded room and they zip away to have sex and they never ask each other about safe sex. You very rarely see condoms being used. So in lots of ways, that whole public picture is actually a good advert for the best way to transmit a sexually transmissible infection, right? But the private face of sexual health is very different. You know, people are often quite shy and insecure about their bodies. They're often shy about knowing how to negotiate sex and how to discuss it with a new partner. And I mean, that can be really exacerbated by having sex with someone who doesn't speak the same language as you, or who's in a different age cohort, or who has a different ethnic background. So I would like the face of public face of sexual health to more closely match the private face. And I think that trying to do some research to see on how we could best deliver sexual health information and services in a really tailored way to suit particular age groups and with different cultural backgrounds, I see that as really being incredibly important. And I think that we've never really taken the time to do this, except in certain key areas. So I think one of the fantastic things about HIV education, at the beginning of that whole pandemic, we didn't spread information very well, but till, you know, halfway through it, we got on board the people that were really affected, which was largely men who had sex with men in Australia at that particular time. We got them on board to help decide how we would deliver sexual health information. And once they were able to deliver it in an appropriate way, that's when we began to see things change. And this is what we need really for all the groups who are well covered for sexual health at the moment. So I believe that rather than using quantitative research, so rather than using big surveys, we actually need qualitative research. We need detailed understandings of what people need, what they understand, what they interpret when they hear certain information. So we need very nuanced research. And so I think that this is the kind of research that we need in the future. I think we need to do qualitative research, you know, with different kinds of people from different age groups, as I said, different kinds of cultural backgrounds. And when I talk about culture, I don't mean just ethnic culture, but the different kind of ways in which they live, the different kinds of lifestyles they have. And I think it's only then that we'll be really able to understand how best to support people make their own choices based on good knowledge and understanding of what's available to them. So that would be my desire, to do more qualitative research to truly unpack everything that people